and welcome. I see here that you're scheduled for a face inspection. Okay, very well. I see here in your medical history they have some issues. You've been having quite a lot of itchiness in your face, mostly. When did this start? A couple of weeks ago? That's a lot of time to be feeling these symptoms. Did you take something? Did you do a home remedy or something that you believe it's going to work for this? Okay, some lotion only. And it didn't help at all. You believed it was dryness and you were trying to use these lotions for that. Didn't work at all? Like 40% you will say, but it continues? Okay. Let's say this itchiness in a scale of 1 to 10, 10 being unbearable itchiness, that it's constant, and 0 being no itchiness at all. In what level are you normally with this symptom? So 6, 7 sometimes. It goes to 8. Well, that's quite a lot. In the past weeks, did you have done anything different to your skin or try a different treatment, lotions, makeup, anything like that that you believe is something new that you have tried? Not that you can think of us. Okay. No, don't worry. I'm just checking here on your medical history. Don't see really anything that pops up that should be of concern for us. Okay. Well, let's start by inspecting your skin. Are you wearing anything? Makeup, lotions, sunscreen? A little bit of sunscreen? Okay. We're going to have to remove that. At this moment, do you feel that discomfort with the itchiness? But not so much. You can barely feel it. Okay. Let me just get your hair to the back. There we go. I'm gonna be putting this so it doesn't get down, okay? You got a kitty mask today. There we go. Okay, let's start by removing it. Okay, we're gonna use a soap base remover. This one is best for the type of sunscreen. Okay, just a little bit more of soap. That's it. It does feel quite good, huh? And the aroma is really relaxing. Have you gone on vacation in the past 2 weeks? Or stay in a hotel? No? Okay. Yeah, I'm asking because sometimes some patients develop allergies. Even if they shower, clean their faces, these allergens stay deep into their pores. So, just happy to know that that's not the case. close your eyes, please? Thank you. Very good. You might feel that your skin is pulling. That's because of the soap that we use. But it feels nice. Very well. We're going to start with the inspection first. We're going to move along with that. I use this light to inspect your skin. I'm going to try not to put it too close to your eyes so it doesn't shine too much. Okay. You're telling me that you suffer from dryness, right? Yeah, I do notice that. Have some enlarged pores in certain areas. Some redness present too. I did notice that your pores are a little bit clogged. Do you normally do a deep cleansing to your skin using exfoliators or anything like that? Scrubs? Okay. Yeah, we're gonna definitely have to take care of the clogged pores because in there could be some allergens that can tend to give you this itchiness. What are the areas in your face that you feel that is more itchy prone? Forehead, this area of the cheeks. Okay. Gonna press a little bit here. Do you feel the itchiness? And here? Okay. How about in this area? Okay. Yeah, this is definitely the area where clogged pores are more visible. Along with this area too. Now let's check your forehead. I'm going to be a little bit more closer to you. Try not to shine the light directly into your eyes, but since it's very close here, it can be difficult. Okay, good. Thank you. Let me just check something here in your medical history that I believe I saw. You had a face cleaned up early last year. You didn't do anything else after that? No, just plain soap and water. Definitely there's an issue with your pores that are completely clogged. It's not noticeable on the surface, but when you inspect it up close, you can notice that there is some debris inside there that could be causing this itchiness that you feel right now. Since at the moment you still feel the discomfort, I'm going to start by making you feel more comfortable by applying some creams that is going to help you with that. And then we're going to start doing the cleanup, which is unclogging the pores. For this, we're going to be using a steam therapy that is going to help open up the pores, and in that way then it's completely scrub off all that debris that is inside the pores. Okay, very well. So let's start by making you feel comfortable. I'm gonna use this. Oh, you're telling me that right now you still feel itchy, so I want you to feel comfortable before we start the treatment at all. I'm gonna try to set it with this. It helps quite a lot with this issue. Okay. Just gonna clean this area. And that should be it. Now you're gonna look forward to me and just enjoy it. This is not the steam therapy. The steam therapy is a little bit warmer. This is just to relieve the skin of the itchiness that you're feeling right now. Feels quite fresh, yeah. With how clogged your pores are, we're gonna go with a 8 to 10 minute steam therapy. And it's gonna be quite relaxing. A lot of my patients actually fall asleep to it. Okay, that's it. Let's apply now the cream. Very well. It does feel good, huh? I mean, every massage is good and relaxing. Good. Let's let that be absorbed by the skin while I prepare your steam mask. Now during the steam mask, your face is going to be completely covered by this mask. The only part that is not going to be covered is your eyes, but we're going to have to put a mask because some of the fumes may escape and can be a little bit hot for the eyes, okay? Okay, let's set up the ingredients here. We're gonna go with the 8 to 10 minutes, depending on your pores, which are pretty clogged. Okay, good. Let's see, the skin is already dry. Okay. Prepare it and apply the tonic. I'm going to apply it directly to the areas that are more prone to the itchiness, which is your forehead, cheek area too, there we go. Okay, ready? Very well. Are you comfortable in this position? We can recline your chair if you want. Yeah? Okay. Let's start by covering your eyes. Let me know if it feels too tight. Are you okay like that? Yeah. Okay. So let me go you through which is gonna happen. You're gonna start hearing some sounds, like sizzling sound, along with some water sounds. That is completely normal. That is the steam going up into your face. It's gonna be very wet, so I'm gonna put a cape around your clothes to protect them. There we go. Are you ready? Very well. Then I'm gonna set the timer first for 8 minutes, and if it still needs more, we're gonna go with 2 more minutes, okay? There we go. Good job. Okay, so let's turn this off. And take this off too. There we go. Clean your face because it's dripping a little bit. Very good. Let's do an inspection again. We're still not done with the treatment, but I just want to see how the pores are. They are more loose. Looks much better. They're still clogged, but they are not shut in that we cannot remove it. Now that they are open, you can just take it out. Let's try with the mask first. Good. This is going to exfoliate the skin a little bit. Might feel a little rough, but don't worry. Almost done with it. To cover the whole face for this to work. Good. Leave it for a bit while I prepare the next step. It does feel fresh. It starts to cool down, huh? Yeah, it's part of it. Okay, now I will be using this brush in the lowest setting. With this, we're going to exfoliate the skin and try to remove as much of dead cells as possible and some of the clogged in your pores. Let's be very gentle with it. know if you can actually notice in the cotton. But yeah, that's all the dead cells, part of the clogged pores. Okay, can you close your eyes, please? Just gonna soothe you after that exfoliation. Good. Okay, let's go with the next treatment. This comes in a roll-on. We'll be passing it in the areas in specific that you have the problem. Very good. And this actually gets activated with water, and we're going to be using our steamer for that, the handheld one. Doesn't need too much. I'm gonna let it set for a minute while I'm gonna be putting your that's what you're gonna take home. Let's see, for your prescription you're gonna take a few drops for your face serum. That's gonna help with the clogged pores. They should be clean now, but we want it to be completely clean of any allergens. So these drops, you're going to be placing them in your skin once you're completely clean before going to bed, after a shower or a bath, with face completely clean. You're going to be applying around 5 drops in your hand, doing circular motions like this, applying in your whole skin. I'm going to be doing this for 7 days, or 7 nights. Let's remove this now. Good. And let's go with the final inspection. By now, your pores should be clean. How do you feel at the moment? Do you still feel the urge to scratch? To itch? Okay, that's good. Now it looks much better. Looks pretty good. There are a few pores here and there that are still a little bit filled up, but with the serum that I send you home, it's gonna completely cover that. Okay, do you have any questions? Okay, well, the itchiness shouldn't be a problem anymore, but if you start feeling it like you did before again, please come with us. We might have to do some biopsy and send it to the lab to see what is the real true reason there. But I believe with this cleanup, it should be fine. Any other questions? Well, it was a pleasure. You're gonna have your prescription right here in the reception with my assistant Karen. And, well, I hope it goes well for you. Of course, take care. Bye bye.